All right, so we're good to go. It's recording now. Please kindly turn off your audio so that we will not have a lot of interference.
Please, can you set it in such a way that only the host will allow people to speak whenever it's necessary?
Okay, let me do that. Okay, so we're starting. Good evening, everybody, again. For today's session, I'm going to be the host. And with me, my co-host, Dubem, turn off your mic so that we can meet you.
Good evening, everybody. My name is Ogambachi Dubina. I am the co-host for today's meeting.
Okay, so on behalf of the founder of YOHAN, I want to officially welcome us to our second quarterly summit. For this session, like I said, I'll be your host. My name is Dr. Ada Mbadiog, and my co-host, her name is...
My name is Ogambachi Dubim. I'm the co-host.
Okay. Dubem is the medical student, and we're welcome again. Okay, so before we call on the speakers to begin talking, I just want to say a brief opening remark on behalf of the CEO. So as we all know, just to be clear, whether we know or not, YOHAN is a non-governmental youth-led association that was founded with the goal to, empower the youths and enable them to create a healthy living for themselves and as well, translate it to the people around them. So YOHAN believes so much in youth, and YOHAN believes that youths are in fact the leaders of today and not tomorrow. We have the ability to take things into our hands and make a change. So today, for this summit, we'll be talking about leveraging on research and innovations to, create better health systems in Sub-Saharan Africa. So we have a lot of people here from across different countries across Africa, different states across Nigeria, and different countries across the globe. Let me not just limit it. So because we are many, we're not going to be, giving formal introductions at all, but we have the group chats on WhatsApp to do that. And yeah, as we know as well, certificates are going to be issued for those that participated in this summit. And it's going to be issued based on, we're going to be providing a Google satisfactory form to be filled tomorrow. So please bear that in mind. It doesn't necessarily mean that everybody that registered for this summit will get a certificate. It's those that fill the satisfactory forms. Okay, so without further ado, let me just go ahead now. Before we call on the speaker, I just want to share my screen and I want us to look at a few things before we call the speaker. So if you can see my screen, please let me know. Can you see what I'm sharing, please?
Yes, we can see it.
We can see it.
You can see it.
Yes, we can see it.
Flyer for this is the program. Okay, so before I continue, let me just share a few things. For some reason, my screen. Let me just share a few things that I believe we would find relevant for the purpose of this program. Okay, so you can see my screen, right?
Yes, we can see
Yes,
it.
we can.
Okay. So you can see what's written here. It says research is formalized curiosity. It is poking and prying with a purpose. Okay. Then the second one says, this one is by Albert Einstein. It says, if we knew what we were doing, it wouldn't be called research, would it? Okay, so let's not waste time. I'd like to introduce the first speaker. She was my teacher. She was my lecturer in medical school. And today she's our keynote speaker for this summit. And she's Associate Professor Dr. Tonya Onyeka. She's a consultant physician anesthetist, pain and palliative medicine doctor at the College of Medicine, University of Nigeria, where she graduated several years ago. She's the founding and current head of pain and palliative care unit of her hospital, the University of Nigeria Teaching Hospital, UNTH, where she leads her team to cater for children and adults with palliative care needs. She's a member of several professional bodies, including the Hospice and Palliative Care Association of Nigeria, HPCAN, the American Society of Clinical Oncology, ASCO, the American Association for Hospice and Palliative Medicine, AAHPM, and the International Association for Study of Pain. She was a member of the technical expert group that provided the first ever pain management guidelines for Nigerian healthcare professionals in 2018. Dr. Tonya is a principal investigation. Okay. Dr. Tonya, sorry? Please kindly mute yourselves. Dr. Tonya is a principal investigator for nationwide pain e-training of Nigerian medical undergraduates and is an associate editor of pediatric pain section of the journal Frontiers in Pain Research. She's also the program manager for the Center of Translation and Implementation Research of the University of Nigeria. Her areas of research interests are adult and pediatric palliative care, pain and symptom management, quality of life, end of life issues, data science, and e-health. She is the team lead of EPAC, Enhancing Palliative Care Research Team at her institution, and has several publications in peer-reviewed local and international journals. And if I might add, she's a very beautiful woman. So please let's make welcome Dr. Tonya Onyeka.
Thank you so much, Dr. Ada. Thank you for having me, guys, and good evening. I'm really happy to be here. I'm excited to see so many young people who are interested in research. When we were much younger, we didn't have this opportunity at all. So I really want to encourage every one of us to, it's very early for you, just start doing research because you will change the world with your research output. Thank you so much. So let me go ahead to start this discussion we have together this evening by sharing my screen. So Dr. Ada, please, can you enable the sharing so I can share my screen? You have to make me host. Yeah, co-host. You have to make me co-host. Okay, all right. Okay, so let's do that in a jiffy, and please tell me when you start seeing the screen.
Yes, we can see it now.
We can see the screen, ma'am. We can see the screen.
We can see the screen.
Okay, thank you. So today we're going to be looking at the topic that says leveraging research and innovation as tools for strengthening health systems in sub-Saharan Africa. I'm going to say a bit of something here that a lot of the references I'll be making in regard to this topic will largely be around Nigeria. I know that there are a lot of participants on this summit that are from other parts of the world, other parts of the continent. Please bear with me, but that's what I think that will also help you to understand how we can use research and innovation to strengthen health systems wherever we are in Sub-Saharan Africa. So I don't have any conflict of interest to disclose. It's important for us to realize that, some progress has been made in improving access to health over 3 decades now in Sub-Saharan Africa. And their efforts are still being made towards achieving universal health coverage. But however, there are significant challenges. So we find that there are hurdles to achieving universal health coverage in Sub-Saharan Africa. I want to use the health system in Nigeria as a case study. For instance, I'd like you to know that less than 20% of primary healthcare centers are running. Now, what are the primary healthcare centers? For those that don't have this nomenclature in their health systems, other participants on this call from other countries who don't use that nomenclature, they are like your district hospitals. Some countries will call them district hospitals. So they're the basic units within our communities that take care of the people in the rural areas. That's the primary healthcare center. So that's the district hospital, district clinic. In Nigeria, less than 20% of them are functioning. And even those ones that are up and running barely have what they need to run. They barely have human resources. They barely have the materials they need to take care of patients. In addition, more than 80% of these healthcare centers don't have doctors, they don't have nurses. They have what we call the community health extension workers. So that these are non-clinical people, these are non-medical people who have been given some medical training and they have some medical knowledge to help in what they're doing. Sorry, I see a hand is raised. Is that hand for me?
Yes, it's my hand actually. It's Dr. Ada speaking. Please, can you make me host again?
Okay. Sorry. I'll have to escape and see. Okay, so just hold on. Yeah, okay. So we're good, right?
Yes, thank you, ma.
Okay. So as I was saying, we're looking at a case study of Nigeria, what the health system looks like. Okay, it's not too encouraging. For our people here, doctors and nurses have to compete with, traditional birth attendants. So gynecologists have to struggle to get their patients from traditional birth attendants. So these are people who use traditional methods to deliver women of increased because of these kind of people, trained people who are taking out. We also have competition with our traditional medicine practitioners. So there are people, they call them herbalists. Our people in the communities, in the rural areas, will prefer to go to them. Why? Because they cost less and they are more acceptable to our culture. So this is what is, parts of our health system looks like now. We have what we call a national health insurance scheme, the NHIS. But unfortunately, less than 5% of the Nigerian population is covered by that scheme. In 2019, we had a program called the Basic Healthcare Provision Fund that was raised to be able to help people access funds for their healthcare. So it was kind of a bigger scheme than the National Health Insurance Scheme. But up to today, we find that it's been poorly implemented and people still have to pay out of pocket to get care for their health. There's also another one called the health insurance under one roof. That one was to make sure that things like the Basic Healthcare Provision Fund and the National Health Insurance Scheme are working, and that people, buy into it, people register under these schemes so that they can benefit. But unfortunately, that also has suffered the same fate as its predecessors. So what is health system? I would like to use the definition of the World Health Organization that says that health systems are all organizations and peoples in action whose primary intent is to promote and restore or maintain health. And according to WHO, there are 6 pillars in the health system. You have the workforce. So the workforce are doctors, nurses, and other clinicians. Matthias, you're raising your hand. Can we help you?
Yes, a very good evening. Very good evening, madam. Yeah, a lot of my friends are actually facing a problem to log in.
Oh,
since,
okay.
The limit has been reached, so I don't know whether you could rectify.
Okay, your friends are finding it difficult getting in. The issue, I believe, because I'm seeing that the participants is pegged at 100, is that it's only pegged for 100 participants. So anyone that does not make it to the 100 mark technologies, is the infrastructure, the equipment that we use to take care of our patients, health financing, and then leadership and governance. So we find out that for us to achieve health-related sustainable development goals, we must have effective health service delivery. But unfortunately, there are so many challenges that impede effective health service delivery in Sub-Saharan Africa. And I'm happy that tomorrow, one of our colleagues will be speaking largely to the type, describing the landscape of the type of health systems, health service delivery systems that we have, and the challenges that they are going through. And I'm sure that even as he goes through those challenges, I will be doing that just briefly. He would also tell us possible solutions, to provide possible solutions to those challenges. So let's look briefly at the challenges in the African healthcare system. We all are familiar that in the past decade, we have been hit, the continent has been hit with 2 pandemics, the Ebola pandemic and then the coronavirus pandemic. And the coronavirus pandemic is the most recent, but it was also the one that exposed the deficits that Sub-Saharan African countries have in their health service delivery system. This study by Dr. Oleribe and his colleagues was a study that tried to identify the key challenges facing healthcare systems in Africa and potential solutions. So they went to healthcare workers and they asked them, what are the things that are hindering you from effectively carrying out your work as a healthcare worker? And they were able to name at least 3. They said the lack of human resources, so the health workforce was reduced. They also talked about financing. The hospitals are not well financed, so they don't have the requisite equipments to use to take care of patients. And they talked about leadership, governance, bad leadership and bad governance, because there was no, but there were poor policies. There are policies that have been created that have not taken off. There are some policies that have been created, but they're not being implemented. They are poor. So those are, and the policies are from the leaders, the leadership, the policy makers. So they were able to pinpoint these 3 areas as areas that were strongly the challenges to the healthcare systems in Africa. So I'll just also delve in a bit. You know, in Africa, we find out that we have limited sustainable finance mechanisms. Where do we get money from? African countries are borrowing, and African countries, as long as they're borrowing money to finance healthcare, they will continue to be, it's a vicious cycle. They borrow and they borrow and they keep borrowing and they keep being debtors. We also find out that many countries in Sub-Saharan Africa have given just a tiny portion of their national budget, their yearly national budget to finance healthcare. Less than 5%. I think in Nigeria, it's about 1.5% of the national budget is to healthcare. And that can do nothing for anybody. It's like a pin in the ocean. Also, another big problem is limited private sector participation. The private sector is a place where you can find people who have the wherewithal to finance hospitals, to equip hospitals. In fact, you find that there are private hospitals that are better equipped than most hospitals that we work in. And unfortunately, the private sector is not being carried along in health service delivery in Sub-Saharan Africa. Another one is the low numbers of scientists leading in research and innovation. We find out that very few scientists are involved in research work and involved in innovation. And this is very discovering, because it is what works for us that we can apply in our context. And when we apply it to work for us, we have found out that over time, we keep borrowing ideas from the developed countries. We keep borrowing ideas from the global north. But these things are things that have been tried. Research has been done in the global north. It works for the global north. And then we import it to our place. It doesn't really work for us. So we need to look into our own system, do the research by ourselves and see what works for us, keep it, and see what doesn't work for us and throw it out. And then of course, there's limited scale up of products. A lot of African researchers have made concrete inventions and innovations that can help the healthcare system in our countries. But because they are poorly financed, because they are not encouraged, they can't scale up their inventions. They can't scale up what they have developed to help our own people. So we need to also think about that. Then we're faced with the huge one now. And I'm talking about the context of Nigeria, which is the brain drain. As we speak now, people are leaving the country. Doctors, nurses, and other skilled healthcare workers are leaving the country. Why? They are leaving the country because government officials are busy embezzling funds and they are underpaying the healthcare workers in the country. There's also the problem of medical tourism. People know that doctors, nurses, and other ancillary staff are leaving. So the hospitals are under-resourced human-wise, they are under-resourced equipment-wise, so they need to look for places that work for them. And that's why we see people going to places like India to go and do surgeries that we can do in our countries, okay? So these are some of the things that we put in the angle of strikes. Of course, like I'm a Christian, and the Bible says that a worker, it deserves his wage. Everyone that works deserves their wage. So, but where you find that doctors, nurses, and other ancillary staffs in the hospital are being owed salaries for months, they have no option but to protest. And we see a lot of strikes in the healthcare sector. These are the things that are pulling our health services down and making it impossible for us to thrive and for our patients to thrive. Then we have the phenomenon of brain gain. Brain gain is those doctors and nurses and other allied healthcare workers living and looking for greener pasture will go to the global north, and the global north will gain them. So what we lose, the global north gains from us. Then, of course, we have things like poor knowledge management of innovation systems, dissemination systems, inadequate research skills and expertise and institutional capabilities to facilitate the expansion of skills and expertise base. And then we have poor African representation in international research and funding forums. That is also big problems that contribute to weakening our health systems in sub-Saharan Africa. So I will mention health system strengthening. What is that? It's simply strategies and interventions and activities that are designed to sustainably improve the health system performance. So if we want our health system in our respective countries to work, we need to look for strategies, we need to look for activities, we need to look for interventions that will be sustained, help improve our performance. So let us look at how we can strengthen the health system through research. One way we can strengthen the health system through research is through the use of open science. So let us look at open science in sub-Saharan Africa. So what is open science? Open science is a terminology that just refers to making freely available all manner of research to people that need it. And these people may be academicians, they may be researchers, they may be students, they may be healthcare workers, but whoever, just making it available, full text, data, everything. So under open science, you have different aspects. You have open access. So open access refers to free and full access to scientific outputs, including resources and data. You have open hardware, so free hardware, free designs, so that people can collaborate and create apps and create SIFs hardwares that can be used in medicine. We have open labs where two or more labs can exchange, collaborate and exchange their data, exchange their reagents, exchange whatever information they have about what they are working on. And so we can see a whole load of the aspects of open science. So what is the principle? What does open science do? When we practice open science in research, it increases the rigor, the reliability, and the reproducibility of scientific results across research fields. So that means that if A in Ghana and B in Nigeria are doing the same research, okay, and A decides to exchange materials with B, freely, because A started it first and completed the research first, and B is about to start. If A can share data with B, and B does exactly the same research in exactly the same way A did it, they will have both the same results. And because they have both the same results, it is valid, it is reliable, it is strong, okay? It's sending out a strong research message. So that is the good thing about open access. There are some publishers of medical journals that practice open access. For instance, Elsevier and Springer Nature, these two publishers were able to release all articles on COVID-19, irrespective of the type of article, original article, review article, randomized control trials, commentaries, anything related to COVID-19 for the entire phase of the pandemic, right up to now, they are free. And the essence is that so that researchers who are working on solutions to the COVID-19 can be able to find things to work with and make their product and make their research better, so that the research outcome can be better and be of high value to our patients. There is this repository called Open Safely, and it belongs to the United Kingdom. It's simply a highly secure and publicly available, transparent, open source software platform that contains the electronic health records of the pseudo-anonymized electronic health records of patients in the United Kingdom. So this Open Safely database is also something that researchers can access and get data and work on it and produce research outcomes that can help patients. Another one that is very popular too is called the NextStrain. It is also similar, but works on research on viruses. Then let's look at open science in Africa. There are a lot of open science platforms in Africa. We have the African Open Science Platform. We have the Open Access for Africa. And then we have the data first. So these are some of the platforms that you as a researcher can apply to receive data and analyze the data in a different way from the way it was used before. And whatever results you find, you see whether it can be of benefit to our patients in Sub-Saharan Africa. This is a picture of the young man that some of us, I'm sure, would have heard and known about, the young man during the pandemic that created a ventilator in response to COVID-19 and the pulmonary effect of COVID-19. So he's in the Gombe State University, and Gombe is a state in the north, in the north of Nigeria. So he created this with some other people. He called it Respire 19. So this is an idea that came out, and what they now, some companies in the UK, they have taken it up. They want to now refine it and produce it and make it available to countries with low risk, countries that can't afford the fancy mechanical ventilators to help patients. And I think this is a great idea. Another way, apart from open science, another way research can strengthen our health system is that we can create research collaborations. For instance, the University of Oxford has an initiative called the Africa Oxford Initiative, or AFOX for short, that facilitates research collaborations between African researchers, okay, and researchers in their own institutions. So you have two researchers, one in Africa, one in the UK, and they sit together and decide to do research that will be beneficial to Africa. There's also the Alliance for African Partnership. It's a consortium of 10 leading African universities and the Michigan State University of the United States. They also do a similar thing. They have partnerships between MSU researchers and African researchers within those 10 universities. They also offer grants that will help these African researchers carry out their research, not just in health, but in other aspects of science. And then there is the ARUA, and ARUA is the African Research Universities Alliance. It's an alliance of 16 universities in 10 nations of this continent. And the aim is to build centers of excellence in research in each university. In Nigeria, 2 universities belong to ARUA. They're the University of Lagos and the University of Ibadan. And then I now talk about the contribution of research in improving health service delivery and strengthening the healthcare system. One way is through implementation science, or implementation science. So we find out that when we use the evidence that we have gotten from research on our patients, then we have good clinical outcomes. So, but a lot of the times, many people don't go to looking at research and saying what has been done that is related to what I am looking out for in my patients. What works, what doesn't work? Many clinicians, many doctors don't do that, all right? In fact, 20% of original research findings, only 20% are actually translated into practice. So a huge 80% are untouched. So in order to bridge this gap, a new emerging field of medicine called implementation science has been produced. And what implementation science aims to do is to shorten the time between when the research is done and when the results from the research is carried out into practice. So to shorten the time from bench to bedside, that is what implementation science aims to do. So how do we define it formally? Implementation science is a study of which strategies can help systems implement, disseminate, and sustain improvements and enhancements. So because we have a problem, We do research, we do good research, it's there, but it's on the shelf, it's in a journal, it's in an e-journal, nobody sees it, or even if people see it, they don't do anything with it. But what implementation science does is that you get the research. You find out, why is this research why is the outcome, the findings of this research, why are they not being implemented? What are the problems that has created, or the barriers that have prevented the implementation? How can we overcome that barrier and get the results that we are looking for? That's what implementation science does. And the good thing about implementation science is it doesn't just get the research findings out there to be carried out so that the patient's life is improved. It makes sure that it is continually used. So it's not a one-off thing, okay? So you don't say, oh, this research found this, let's do it, and then after you've done it for 1 year, you stop. No, implementation science ensures that it's sustained and that it's improved upon. You can improve upon that, the research findings that you're implementing in the hospital and on your patients. The other key terms we need to know are dissemination research. It's simply the scientific study of targeted distribution of information and intervention materials to a specific public health or clinical practice audience. And the intention of carrying out dissemination research is so that we understand, how do we best spread the research or the evidence we have? How do we best sustain the evidence we have in real-time clinical practice? Then that's different from implementation research, which now looks at the use of strategies to adopt or integrate evidence-based health interventions into clinical and community settings so that we can improve patient outcomes and benefit the health population. So in a nutshell, this is what I'm talking about, okay? You have from bench to bedside and beyond. So that's what implementation science does. It doesn't just stop in the hospital. It goes into the communities. So from where you're doing your research, moving into the communities and ensuring that your research results are sustained in the communities. So I'd just like to speak of a very important example of implementation science. This is an initiative called the Baby Shower Initiative, that was led by Professor Echezana Ezanolue. And what happened was that at a certain time, some years in the early 2010 and 11, you had people like USAID, they're putting money for HIV, PEPFAR is putting in money into Nigeria for HIV, but they were not seeing the results. They're putting money so that women, men, and all affected get their drugs, and they can, manage, HIV is now a disease when you take your medication, and they can manage themselves well and live long. But they were not seeing this. So money was coming into Nigeria, but they were not getting the numbers in terms of how many people were tested, how many people were getting their interventions, they're getting their treatments, how many people were being having their CD4 counts done regularly. They were not getting that. So Professor Ezanolue and his colleagues thought of doing something. They thought of creating an intervention that would increase the uptake of testing and linkage to care. And they focused on pregnant women in Nigeria. So what they did was they said, where do these pregnant women gather most? And they said, okay, they gather in church is a nice place to see these pregnant women. And pregnant women, they go to church, they want to have safe delivery, they pray, and then when they've had their babies, they come back to church and they dedicate their babies and they come and thank God for a safe delivery with their families. They said, okay, why don't we do something? Why don't we create a baby shower? So, because baby shower is not in the Nigerian culture, and I doubt it's I'm not sure if it's in any African culture, but in the Nigerian culture is not there. So baby shower is usually something done with the Europeans, with the Americans, and people in the global north. where the woman, a few weeks or a few days to her delivery, she comes together with her friends and they have a party for her and they give her gifts. They're usually baby things. That's what's called a baby shower. So Professor Isanole said, why don't we call these women together, see them in church, and organize a baby shower for them? And in organizing a baby shower for them, we talk to them about the need to test their HIV status. And we also encourage them to bring their husbands along. And we encourage their husbands to get tested. And in doing that, we refer them to a lab where they can get their care free of charge. Then they can also, if they're HIV positive, they will get registered and get medication free of charge. And that's what they did. So over a couple of months, they were able to get the evidence that this intervention called a baby shower, where women will gather in church on a Sunday, the priest will pray for them, they will get their samples taken, they will be reached after that Sunday. For those who are positive, the counselor will go to their homes and meet them. I'm sorry, did I lose you, or did you lose me at any point?
We are with you, ma.
No, ma. We are getting you.
No, we are with you,
Okay,
ma. Right on.
Okay, so you did not lose this presentation. All
yes,
right.
ma'am.
No.
Okay. So when the samples are taken, for the women that are positive, they are the counselors will visit them in their homes, and including the husbands that are positive, and talk to them and counsel them and encourage them to go do CD4 count, to go get start their medication. So this was how these pregnant women that were HIV positive were caught in time. They were tested, they had counseling with their husbands, with their spouses. And when they got the relevant treatment, so that when they delivered their babies were HIV negative. This baby shower initiative was carried out in 44 villages in Benue State, and was highly successful, and is about to be carried out nationwide. So this is, and it is still on, because we have people in those villages, counselors, who are still recruiting pregnant women. So it hasn't stopped. So once a woman is pregnant, they already know there's a baby shower initiative. They go and meet the counselors, the baby shower initiative counselors in their village, and they are tested. And then, they go through the protocol. So it's still ongoing, and we're recruiting. Right now, we have a cohort of 66,000 HIV positive women. Some have delivered, some are still pregnant. So you see the beauty of implementation science. It makes sure that the research outcome, the good part of the research, is sustained, is continued. So it's not going to be stopped. And that's why we're going to ensure that we take it nationwide. Now, we're going to see briefly how we can use digital health technologies to strengthen our healthcare system. One digital innovation that we all know about is the health management information systems. They usually provide routine data for our health managers, for our project managers to work on, so that they can improve the quality of care of our patients, improve the quality of care in our hospitals. This is very important for health system strengthening. But unfortunately, in many low resource settings, especially in Sub-Saharan Africa, we don't have health management information systems. Where we have health management information systems, they are not keeping the data, or they are keeping the data poorly, and therefore the quality of the data is poor. So some professors in our institution with their colleagues decided to carry out an intervention to see whether the health management information system data that was collected during the period of the intervention would be complete. So it is sorry, let me go back. So a program in Nigeria called SureP is an empowerment program that was carried out by the federal government during from 2012 to 2015. That was what they used to check. They looked at the period before the health information system was used. They looked at that, which was before the SureP program. Then they looked at the period the health management information system was used during the SureP and after the SureP program. And they compared and they found out that while the program was going on, while the SureP program was going on, they were able to collect good quality data related to maternal and child health services in Nigeria. And that data has also helped to improve maternal and child health care services across the country. Now, we'll talk briefly about health innovation, because when we're talking about, we talk about research, leveraging on research and innovation to strengthen healthcare, health service systems. Then we look at the innovation aspect of it. What is health innovation? They are simply products or processes, organizational or institutional arrangements that are new to a context or new to the world, which create public health value or reduce disease burden, leading to improved livelihoods and well-being. These are a few examples of the innovation. So one aspect of innovation is mobile technology. So things like SMS messaging, WhatsApp, and using social media like Facebook and Twitter have been shown to improve clinical outcomes in patients, have been shown to improve health service delivery. So in countries, I know that many countries in Sub-Saharan Africa may not have the spread and the reach of the internet for their rural communities. This is something that in Nigeria, we are blessed that a lot of our rural communities have access to the internet, except the issues of it being interrupted, things about power supply or being intermittent, but there is some good coverage in the rural areas. But some of our brothers and sisters in other sub-Saharan African countries don't have the luxury of this. But I'm bringing this forward so that we can understand that even social media, even mobile technologies, using a mobile phone can help us improve and strengthen health service systems to help our patients and our populations. So I just want to talk about other things and other ways in which research and innovation can be used as tools to strengthen the health service system, okay? When we do research, we create and we generate and share knowledge. We create, we generate, we share knowledge. Also, if we can make finance a priority, if we can say we assess funds in our different countries, our policymakers, our leaders can get funds and say we push funds into healthcare, buy equipment, pay hire healthcare workers, pay them, that will help. Of course, governance and regulation, having policies that favor the healthcare system. A lot of the problems that we have in Sub-Saharan Africa is that we create good healthcare policies and we don't follow through. We don't implement them. So instead of them being on paper, gather a number of people and they produce a white paper as a policy for a health decision, and then we leave it there. We need to make sure that we carry it through. Those policies are implemented. Coordinating research, managing research is very important. In every country, we should have a coordination of our research. One, we should have a central ethics and review committee. So like Nigeria has a national REC, Review and Ethics Research and Ethics Committee. so that anyone who wants to do research anywhere in Nigeria can apply to them and get approval to do that research. So we need things like that. That will help us to manage research. We also need institutions, research institutions, and there are many of them in that manner. Then we need centers of excellence. And I told you about AROA, which is 16 universities in 10 nations that have decided they want to build centers of excellence for research. And then we need to strengthen ties and connections between stakeholders. Who are the stakeholders? Patients. A lot of the times we're doing research and we forget that we need to reach out to the patients to get their own view, their own opinion, their own buy-in into whatever we're doing to help the end in the healthcare system. And then most importantly, we need to support female researchers, okay? A lot of our female researchers, many of them are within childbearing age, so their career in research is disrupted by childbirth. You know, you have to have baby 1, 2, 3, 4. Before you know, the years are going, the productivity is waning. So we need to support females also in research. Let's look at the role of partnerships in transforming the healthcare system. We know that there are a lot of global initiatives and global partnerships between large bodies like Gavi, like PEPFAR, and countries in Sub-Saharan Africa. But there are a lot of things that we also look at this evening. We need to have partnership between biotechnological companies and the universities so that it is not just all work, and everything is piled up in dissertation work or is piled up in one library somewhere. We need to have a fusion between biotech and academia. And we need to begin to view science or health as a business. So not only are we helping our patients, we use our research to generate money that we can plug back into the health system and strengthen it financially. So for now, most of the biotechnological companies are located in places like the UK and the US and Singapore, but we need to create biotechnological companies. For instance, the company called Gilead, that's the one that is known for producing a lot of very good HIV drugs. And in fact, lately produced 2 medications for hepatitis C that gave 90% cure to the patients that were tested. So, but these companies this Gilead is in the US. So we need companies like that in Sub-Saharan Africa that can work on things that are problems in Africa and give African solutions. We also need to attract either local or foreign investment into science innovation, into health innovation to help us to strengthen our system. The Yamachi biotechnology is a good example of where biotech and academia comes together. The founder is Ghanaian, the company is located in Ghana, and they're doing very well. So these are some of the ideas that those of us that don't have it in our country, we can take these ideas back. These kind of partnerships can help strengthen our health systems. This is an institute, the Oswald Cruz Institute. The Oswald Cruz Institute was established in the 1900s, and it was established as a result of the threat that was in Brazil at that time. They had 3 epidemics. They had the bubonic plague, which was a pandemic. They had the yellow fever, and they had smallpox, all happening at the same time. And they decided, some individual decided to create an institute. But today, this private institute has now partnered with the Brazilian Ministry of Health to produce vaccines and other drugs. They also produce, they're also into hospital research, and they train health workers. So this partnership is an example of how we can use research to strengthen the health care system of our respective countries. There's also the African Health Initiative. The African Health Initiative is something that was started by this foundation called Doris Duke Foundation, located in the United States, okay? And it's simply a research program that the African Health Initiative is a research program in 5 countries, and they are looking to strengthen the health system of those 5 countries at the district level, at the primary healthcare level, so at the communities, and they get funding from this foundation. So that is all for this. Then another way that we can strengthen, use research and use some innovation to strengthen our healthcare system is through what we call public-private partnership. And this was a study done by one of our professors with his colleagues here at the University of Nigeria, looking at whether public-private partnership can work. That means the hospital, the University of Nigeria Teaching Hospital is a public hospital, and then it partners with a private hospital, and maybe the private hospital says, I will put 5 ultrasound machines in your hospital, the teaching hospital, and patients, we will take the cost of the ultrasound down, and then patients will come, but as they pay, we share the costs. Okay, so as patients pay for the service, all this does is that it ensures that at no time do people come to UNTH and start looking for where to do ultrasound. There'll be ultrasound available at all times for any patient. There won't be any time where you say, oh, the machine is not working. Why? Because the private person that put the machines in the public hospital will be the one responsible for servicing and maintaining those machines. So because he knows that he's losing money anytime the machines are bad, he's on his toes to make it work. And because the machines are working, people are coming to have their ultrasounds done. And because people are coming to have their ultrasounds done, the hospital is getting money. And the private person who brought the machines to be functioning in the public hospital is also making money. So the public-private partnership in healthcare is a win-win situation. And that's where many countries are going. In fact, Nigeria is heavily investing in public-private partnerships, not just in healthcare, but in many other aspects of life. So what are we going to take away from this talk? We need to establish a research culture. And now this research culture has to be by Africans, in Africans. We're not saying you can't get help, but remember, we can collaborate. We've seen collaborations with foreign institutions, either research collaborations or funding collaborations to help us to do research in our country, for our country, to help our healthcare. So we can start by having a research culture. And that's why I'm excited this evening to see the number of people that are struggling to get into the summit, because it tells me that young people want it to make it right. Young people are getting it right, because when you start to research early, when you start getting engaged in research very early, then the outcome will help our people. And that means that it will move our nations forward. We also need to think about e-health solutions. And if you notice, I didn't talk much about the e-health solutions like apps, because I know that a colleague of mine will be talking about it tomorrow. So, but we're going to see how digital health, e-health solutions and apps can help us to strengthen technology as such can help us to strengthen our healthcare systems. And of course, we need to think about regional institutes of excellence. We need to think about centers of excellence, because in having these centers of excellence, it means that people become, within Africa, people become dedicated to ensure that whatever research output that they have is excellent, that it has rigor, and it can be defended any day, anytime, anywhere. So in conclusion, I'd like to say that access to science holds the key to strengthening health systems, advancing scientific research, and efficiently training Africa's next generation scientists. And the academic research is the engine that drives innovation and should be supported by internal, private or government funding, and external, which is foreign funding. And then strengthening healthcare systems in sub-Saharan Africa is necessary to effectively prepare for and respond to the next health threat, so that we won't be caught unawares like we were for COVID-19. So this is where I end my presentation. These are my references, and I think I'm ready to take your questions. Thank you.
Okay, thank you very much, Ma. Please, if you have questions for her, please, can you raise your hand so that we can see you? Okay, starting with Edward. Edward, you can unmute yourself and ask your question.
Okay, thank you for the chance. Thank you, Madam, for the nice presentation. It was so great. I have the two questions I would like to make. The first question is on the open science, particularly on the innovational part. It's being hypothesized that as we are Africans or sub-Saharan country, we are living in a destitute poverty, on how we are sure that the innovation is going to mitigate the burden or the challenge that is facing the health systems, while our economic status is still lagging behind. On how we can improve and mitigate the challenge. Still, we have this challenge of the financial problem. And the second question is on the implementation sciences. Of course, the data is well organized that 20% of the research are those who implemented. As we Africans, the level of the research that most is being conducted, I can say that is not concomitant to be implemented due to the lack of the level of the evidence that the research is being done. Most of the research is being done, it is a low high rank in case of the evidence in research. Can this be the challenge to hinder this implementation science? Thank you.
Okay, thank you. Let me rephrase so that you tell me if I'm right. The second question is that a lot of research coming out of Africa is below standard. Can this hinder implementation science research? Is that the second question? Sorry, I can't hear you, Edward. You're muted. Can you unmute your mic? Yes. So did you hear me?
Yeah, exactly.
That was your second question, right?
Yeah, exactly.
And then the first question is that finance is a problem. You mentioned open source, and you said a lot of our countries are lagging behind, especially in terms of finance. So I didn't quite understand that first question.
Okay, let me repeat. My question was concerning the open science, particularly on the part of innovations. It's being hypothesized that most of the sub-Saharan countries, they are living in a destitute poverty. On how we are going to mitigate the challenge that face the health systems, while still our financial economy is still lagging behind, and the people, they do live in a destiny poverty, on how they can access those mobile phone, on how they can cope with the innovation that is being done, on how they are going to engage in the innovation, while still the country have not enough finance.
Okay, so I understand. So
okay,
a lot of our countries are poor. We're lagging behind, in things like internet and so we're not up to date with the innovations with some other countries. So what can we do in order to help our healthcare? What can we do? For me, I think what we can do is do little research that can give you evidence that you can take to your policy maker. You can take to your governor, you can take to your chairman in the local government and say, look at this works. This thing is okay. What can we do about it? So when the policy makers are the ones that we need to take the evidence to and say, people in these countries are doing this. We tried this here. We don't have much, but we tried a little and it worked. Can we get funding to spread it? Can we make funding, get money to make it reach more people? So that's the answer to your first question. Then your second question, remind me again. Who can remind me? I rephrased that second question.
Okay, was on the level of the evidence.
Aha, yes, because a lot of our research are not done appropriately. I understand you, a lot of, and that's why I'm happy all you guys are all on this summit. A lot of our research methods, there's a lot of fabrication of data, there's a lot of plagiarism, there's a lot of insincerity in African research. That's true, but it also happens in advanced countries. This year alone, a lot of Chinese publications were pulled out of journals because they cooked up the data. So how can we have excellent, a strong health system when we have research that is not at par with research from other parts of the country that can help us? It starts with you. You're starting, all of you on this summit, you're starting early. Learn the rudiments of good research. Learn the rudiments of doing research honestly. And so that when the number of you are more than 100 got on this call, I'm sure 100 other were logged off because they had reached the limit. If 200 of you are doing serious, honest, and good research, you learn to do that and you do that, you clear all and you can now use your good research and find people implementing it. So it is for us to spread the word that anyone interested in research should learn it well, learn to do it well, hook up with good research groups like this group. YOHAN is a good one. Hook up with YOHAN, be a member, get your friends, be a member, think of look at the needs, look at the research needs around you in your country and begin to do something about mentor you and in research, someone who's done good research that is out there on the internet, the person who mentors you. That is the way you can now eventually find that you can translate some of your research findings to the bedside. So from your bench to the bedside and even beyond in the communities. So I hope I've answered your question.
Yeah, exactly, madam. Can you allow me to ask the last question?
Okay, yeah, sure.
Okay, thank you. I see the challenge in the case of the connection between the researchers and the policy makers. Most of the policy that we have are not much aware of our research, and they really note our research and papers on how they are going to make the policy while there is not a great link between the researchers and the policy makers. For instance, for example, we have this study of non-communicable diseases. The risk factor is well organized. Also, in the case of the cancer, the risk factor is well recognized, but once it comes to the implementation, when you are required to ban some risky factors, either modified or non-modified, it becomes a challenge. For example, the issue of smoking, alcohol, it's a little bit challenge. Only how, as researchers, we are going to mitigate or to address this kind of the challenge and this link between the researchers and the policymakers. Thank you, madam.
Okay, yeah. So how do we get to create an alliance between us, the researchers, and the policymakers? Very simple. Let me tell you one example. Look for a government official who has a need in the area of your research niche. For instance, I'm a palliative care physician. And then one day I went to take my daughter to see a pediatrician in the hospital. And I stumbled upon a serving senator in my country. And I didn't know him, he didn't know me. But what happened was the pediatrician turned to me and said, this senator's mom has breast cancer. She's upstairs and she's really very ill. You need to see her. So I went up with the senator and I saw her. And I saw she was dying. And I knew that the senator did not know his mother was dying. I knew she would not survive the night. So I took him to one side and I decided to, what we do, break bad news, counsel him in order to get him prepared. So as I was doing that, I found out that he wasn't very, how would I put it? He didn't quite think that he was going to lose his mother. But I had done my job. I had talked to him. I had told him to prepare. He was busy saying, let's take her to the teaching hospital. We need oxygen. So he went on his phone and called my CMD then and said, listen, I'm bringing my mother, send an ambulance. And they sent the ambulance. It's 30 minutes away from where we were with the oxygen. And they left. The next day I heard what happened because I asked my residents on call. I said, in the ICU, because he called the CMD and said, I want my mother to be in the ICU. So my resident said, Chief, when this woman got here to the accident and emergency, we were called. When we rushed down, because I had informed them, look at, there's a patient coming. So he said, when I got there, the woman was already dead in the ambulance. So anyway, to cut a long story short, I later in the week, I called the senator and I offered him my condolence. And he told me something. He said, Tonya, I'm very grateful for that talk you gave me. If you did not give me that talk, I would not be prepared. So it was an opportunity for me. And I got to talk to him that what I did, is called palliative care. He said, I didn't know that anything like there's a branch of medicine like that. And I we just kept talking and talking and talking. So that's another way we can do it. We can find what personal health problems they have. We can do research around it and go and show them and say, see how we can help. So that's one way we can do that. I hope that answered your question. Okay, yeah, you're muted, Edward. Okay, so next question, please. Who is going next?
Okay, thank you very much, Dr. Tonya, for this opportunity. Can you hear me?
Yes, I can, very loud and clear.
Okay, so my question is, targeted towards open science. When you talk about open science, and you made mention of open access,
yes,
where all the public health, will be made available for young researchers like us to have access to all of them. So I'm like, if all the published documents are being made access to us, don't you think it's going to make us a little bit lazy? Like, instead of us to go in there to research on our own, we tend to prefer to go and look at what others have done and then try to copy some stuff from there and increase it.
Yeah, well, there are checks and balances in science and in research. If someone decides like, let me just go and just copy what somebody has done, You know the check and balance for that. When you now want to publish the research, because the only way to make your research finding available to the public, both the scientific and the non-scientific public, is by putting it in a journal. No good journal will accept it. There is no journal worth its onion that will accept it. At the end of the day, it will be on your table. It will not go out. So because you want to do good quality, you want people to see what you have done, and you want people in Japan, in Singapore, you want people in Russia, in Ukraine to see your work. You don't want just people in your town or your village to know about your work. You do good research and you publish it. Yes, work that has been done before can be replicated, but it also depends. So what open access is good, because what open access does, it makes journals, journal articles available to you, so you can read and see what others have done that can also help you in your research. Remember that when you read research, and you want to replicate the research, you have to look at the shortcomings of that research, the flaws, so that you don't repeat those flaws. So, and in avoiding those flaws, you have used your research to make the previous research better. Do you understand? Also, open access is good because you can now cite other people's work, other research that have been done in other parts of the world that are similar to yours, and you can compare their outcome with yours. So that's why open. So there are checks and balances in research that will prevent you from prevent a lazy person from just doing copy and paste. There's also plagiarism checkers. If you plagiarize, no matter how you plagiarize, the plagiarism checkers will catch you. And no good journal that is what is onion will accept your research for publication. I hope I've answered you.
Yes, thank you.
Okay, next. Next question. You're all muted. If you have your hands up. Munachi.
Thank you very much for this opportunity. I'm a student of University of Nigeria Theology, and for the longest time I've been trying to involve myself in research. Now, someone who doesn't have, idea whatsoever about research, I've tried to, make research on, because obviously it's almost impossible for me to carry out a personal research based on, the funding and the knowledge, the expertise. I don't have any of that, and I've tried to make findings if there are research centers around me, but I haven't found any. Now, what would you say to someone like me who has zero idea but is keen on, learning these things, the whole research methodology and the rest of them?
Okay, what I would say to someone who is keen on being a researcher but doesn't know how to go about it is that, one, YOHAN is a good place to start. So because you will get to see a lot of people who are into research come and talk to you. That's one. So you join an organization like this. Then the second is that you can also look for a mentor. So you look for someone that's been doing research that is in an area, because I always tell people, don't go and say, I'll do research, become a jack of all trades and a master of none. Focus on an area. Are you interested in pediatrics? Is that a specialty? Are you interested in internal medicine? Do you want to be a surgeon? Or are you doing things inclined to obstetrics and gynecology? Then you look for researchers along those tracks. Then another thing you can do is also look for established research groups or research centers. Some of them would take medical students. Some of them would take newly qualified doctors to understudy the research process. So these are the things. Then the fourth thing you can do, there are internet resources on the internet that you can go to. There's one provided by Hinari that is free, but it's not there all the time. So they have batches. They do, I think, twice a year. At the beginning of the year and at the end of the year, they will advertise and say people who want to learn about research methodology. And just today, I was sitting with the immediate past provost of the College of Medicine of the University of Nigeria, Professor Waga, and I was sitting with the director for postgraduate medical studies, who's also a gynecologist, Professor Dim. And we were talking about putting the course research methodology in the curriculum of medical students. So that that's what we're looking at, talking to the dean about that. That will help medical students appreciate how to do research so that by the time you are coming out, you know where to get funds. If you don't have funds for research, there are places to search for funds and get the funds. You know how to write up your proposals to get those fundings, then you know how to carry out your research, and then you know how to publish it. So there are resources also on the internet. So there are 4 things. You can get the resources on the internet, you can get a mentor, you can join a group, an organization like this, and you can, have some basic background in school. Okay, so I hope I've answered your question. So Augustine Sunday. Augustine Sunday, you're muted.
Good evening from this end. Sorry, can you hear me?
Yes, sure.
Okay, thank you very much for the vast explanation you have provided. I have a number of questions that I would like to ask. Number 1, as an undergraduate student who is keen and have a serious passion in research, and there is no facility for that in the school, where and how can such person who has a passion for research, how can he go about it, seeing that there is no facility within the school environment to cater for probably a personal research of a thing? So that is one. Then my second question is, how can one write for a research grant, and where can what organization can one look out for grant? And then finally, sorry, can you hear me?
Yes, sure.
Okay, finally, where can one search for where to publish journals, like where to search for journal publication? So these are my questions. I don't know if you get them.
Oh, yeah, sure. So let me start from the third. I remember the third and the second. By the time I get there, I probably remember the first. But the third one, where can one search for journals that they can publish their research in, right?
Yes, exactly.
What I tell medical students is I do a simple thing, which is very simple. Everyone can do it. But for medical students, say, first of all, what are you writing about? What specialty?
Okay.
Then, what specialty are you interested in? That specialty, you can just go to Google and type journals in pediatrics. When you type that, you have a whole list. Then you can go through them one by one and look at the author information, look at the requirements for publishing in those journals. That's one way to do it. A second way is go to YouTube. In fact, YouTube, how to do this, how to search for grants. You type it, or you can go to Google and say grants for medical research. It comes up. So those are ways. You can also search by funding institutions, WHO grants, United Nations medical grants. You can search for TED Fund. In Nigeria, we have a grant institution for universities. It's called TED Fund. So doing Google and putting in those search terms can help you get that. How to write a grant proposal, how to write a grant proposal to get funded. There are a lot of resources on the internet. You can do that. But like I also said, for you that you're not in a place where there's maybe a research institute or a research center, or there are no mentors, I mean, you have to create a network. And like I said, YOHAN is good because YOHAN can link you to a network where there are people with a like desire with you to do research. You can learn from them and grow in doing research with them. Then your first question, I'm trying to remember, what was that?
Okay, as an undergraduate student, whereby there is no facilities for carrying out or provision for carrying out research, except for maybe graduate thesis, how can one do in such a condition?
I know it's very difficult. I remember myself, but even my my ComEd project was just God that saw me through, you know, that kind of thing. Because there is no emphasis in the medical curriculum on research methodology. Is a big problem. So what I advise you to do is to reach out to somebody in another institution. Try this network, YOHAN, is good because you can reach out to someone in another institution, not necessarily even in Nigeria, but in another country who is already doing research, who is in the research network, and who is a medical student, and link up. So that's a good way. That's one good way to do it. I hope I've answered your question.
Yes, yes, thank you very much. God bless. Okay. Thank you. I'm grateful.
You. God bless you too. Tolu? Oh, INDX has had hand raised. Okay, Tolu, please hold on. Just hold on. Let's, who is INDX? That hand has been up for very long.
Okay, ma, please, this will be the last question.
Oh, I'm sorry. Okay, so
yes,
okay.
No problem.
Yeah. Dr. Dangana is here. Yeah. Yeah, welcome, Dr. Dangana. Tolu, the last question, please. Go ahead. You're muted. You're muted. You're muted. We can't hear you, Tolu. You're muted. Unmute yourself. We can't hear. Okay. Unmute yourself. Can you?
Okay. Good evening.
Yeah.
Okay, so the session has been enlightening. So I have two questions. The first one is that in improving healthcare, like you said, there are a lot of like grants and a lot of organizations giving out funds to like improve healthcare. So I would like to know the main challenge in doing healthcare and research. Is it insufficient fund or wrong methodology and implementation, or the inability to reach the target population? Now, what is the most disturbing challenge? And my other question is that, is research active or passive? And what I mean by active is that, does it require practicalizations, or their research that is passive, that is, you just need like to do literature reviews without actually practicalizing or testing in the laboratory?
Yes, I answer your second question. Yes, there are researches that you can do that you don't have to talk to any patient, you don't have to give any intervention, you don't have to give any drug, you don't have to see any human being. Okay, so research like systematic reviews. Okay, systematic reviews, meta-analysis. Those are the research that will require you to gather what has been done before and sift through the evidence to produce your own evidence. Scoping reviews also require you to sift through a lot of research work that's been done in the area that you want to look at and then produce your own results. So those ones, you don't have to see patients, you don't have to see human beings, or you don't have to have subjects or participants. Then you have the ones you have that you have to, that may be either qualitative, where you interview them, or quantitative, or where you have to provide an intervention. Maybe you have to randomize them, like a randomized control trial, okay, or a mixed methods, which is a bit of each in the intervention, in the research you're doing. So yes, I forgot your first question now. So, but type it or send it to the organizers, and I will give feedback on that. Yes, and I saw something I wanted to respond to. Someone was saying, yeah, that was Abubakar from Sierra Leone, was saying that what his head of department told him that the next step in national health transformation was get health-minded individuals into politics. Yes, that's good, but we still have some doctors in politics, but still not helping us. So we are the young ones, are the reformers. We need to reform the system, put a lot of research out there, staring them in the face. They have no option but to obey us. They have no option but to do what we suggest that we should do based on the outcomes of our research. Thank you.
Okay, thank you very much, Ma. It was a very enlightening session. We appreciate. Thank you so much. Some of the participants are asking if you could share your slides so they can study further. So I don't know if that's okay with you.
Yeah, that's fine. I will send them across.
Okay, so and what everyone should do is just to drop their email on the WhatsApp group and we'll forward these things to you. We sincerely apologize for the inconveniences caused. I understand that over 100 of us are still trying to join, but the maximum capacity was 100 people. We were not aware of this, and the problem is completely from our end, and we are deeply sorry. However, the session is being recorded and we'll make it up. So we have our second speaker here. So at this junction, I want to call on my co-host, Jibin, to introduce him.
Okay. Hello once again, everyone. Good evening. I hope this experience has been rewarding so far. So we'll be moving on to the next sub-theme by the second speaker. But I'll first be sharing two research quotes. Sorry, can you see my screen, please? Please, can you see my screen?
Yes, yeah. Yes, we can.
Okay, so the first one is Google is not a synonym for research. And the second one is research is creating new knowledge. This is by Neil Armstrong. So the next, I'll be sharing the citation of the next speaker. Dr. Jonathan Dangana is a Nigerian public health professional and serves as a technical advisor to the Africa Health Agenda International Commission. He has worked as a consultant for government and non-governmental organizations and as a policy fellow. He has held various talks on TV and workshops for the African Institute of Public Health Professionals and Sustainable Development Goals Frontier Symposiums. He was a board member of the Network Towards Unity for Health, president and board chair of Student Network Organization, International Student Network of Medical and Allied Health, and has also worked as a volunteer to ADRA, AHI Nigeria, Lagos Waste Management Authority, and Obafemi Awolowo University Teaching Hospital in Nigeria. He is a research fellow at the Nigeria Institute of Medical Research, fellow of the Global Health Education and Training Services, USA, and the African Institute of Public Health Professionals. He is a UHC advocate among his peers and students, with endeavors championed through the lens of Sustainable Development Goals 3, 4, and 17, and creates research niche in health policy, leadership and partnerships, reproductive and women's health, scaling awareness of health disparities among deprived communities and vulnerable groups, among others. He completed his PhD in public health, health systems and policy, with a focus on fragile and conflict settings at Babcock School of Public Health and Allied Health, and now lectures in the Department of Public Health at Babcock University. So let's welcome Dr. Jonathan Dangana, our second speaker for today, a seasoned public health professional who will be speaking on the sub-theme, an overview of the health systems in Sub-Saharan Africa and the challenges. You're welcome, sir.
You're welcome, sir.
All right, thank you. Can somebody confirm able to hear me, please?
Yes, sir. We can hear you.
Oh, great.
Yes,
It's a pleasure to be on this experience. I deliberately did not come forward with some slides, not because I don't have them, but often at times my experience have shown me that your audience will always just focus on the slides instead of catching the information therein. So that can always be made available thereafter after the presentation. Thank you very much for the kind words. Sometimes it feels as if it's not the same person that is being spoken of. I followed carefully the first presentation and some questions. Maybe before I just talk about the health system, an overview, let me also share a few thoughts of mine. Research, it's wide and wide and wide and wide. Maybe another good way to kickstart if you are still in school, regardless of the discipline, whether you are a medical student or a public health or a nursing or a pharmacy student, there must be always that lecturer that you admire in school. So you can just go on Google Scholar or on Google, type his name out. You will see some journals that the person has published. Pick on one of it, and then that can be a good sale. Okay. The second point I will make is, in conversations like this, it looks very simple and easy to get, talk about publishing, go and publish. Publishing is not free. It also costs money. So what I will advise is if you are an early career, which is the language that is being used, generally for freshers, right? An early career professional. Every university has what is called a university journal, or it has a professional journal. Start from there, and then you begin to grow. Learn through the rudiments. And there is no hard and fast rule. You send one paper and you get rejected and rejected. In fact, I have one particular paper, that for the last 2 years, it's been 1 ton of rejection and 1 ton of review or the other. So you always have those kind of experiences. So please, bear that in mind. As easy and as interesting as the conversation starts or is, when you get into action, it is not as sweet as the narrative is. But at the end of the day, you have every reason to be happy that you went through all of that. Now, back to the context and the subject of what I am going to share with us today. In Africa, we have a varied number of issues as far as the health system is concerned. Now, when I talk about the health system in this context, I'm referring to every facet of activity that will add value to the health system. And in this case, you are looking at every health professional. You may want to look at it through the 3 tiers of leadership, federal, state, and local government. And then, of course, if you want to contextualize it in the sense of health care, you have primary health care, you have the secondary, and then you have the tertiary. So all of these systems, how does the system work? So, number one, does it mean that there is no hope completely in the continent of Africa? Absolutely no. That is not true. There are some rays of hope. But is it all rosy? Absolutely no. In fact, we are suffering the most. Those of us who are on this call, I am sure you have at least 2 or 3 persons that you know who have relocated. And the street word is Havjapa. Okay? They've relocated to UK, some to Canada, some to the US, some to Australia. Brain drain. Brain drain is one huge reality. And then, of course, you begin to ask the question, so what are the forces that are responsible as to why individuals are taking a new leave as far as professional life is concerned? Those issues, those questions that beg for answer are also part of the problems that the health system in its entirety is facing. Okay? Now, you also want to look at, okay, if you want to say, no more, it's not about those who are who are relocating, who are traveling, you want to come down. You realize that, which is a question I often ask my students, how many of you will be happy you are possibly on this call and you are schooling at the University of Nigeria in Nsukka, or you are in UI, or you are in Unilag, or you are in ABU, or University of Maiduguri, regardless of where you are. If on the day you are taking your oath or the day of your graduation, then the king of your village will also come for your graduation, and now will come to you with good news to say, in fact, the village is happy that you have graduated. We are here to say that we are offering you a job to be the health officer of the whole village. What will be your reaction? Will you jump to say, yes, this is what I have been waiting for? Or you will say, Your Royal Highness, thank you very much for this opportunity. I will think about it and get back to you. That is for those who want to be polite. Some will go outright no, to say no. Now, the question is, why, what are the issues involved as to why you wouldn't want to go and function in your local community? Those questions that begs for answers from you are also part of the health system problems. But does it mean that there is no health system problem in the community where you come from? Absolutely no. It means that there are also issues. But does it mean that in the community where you come from, there is no health infrastructure? No, there is. So you can see that at the end of the day, there are pros and cons within the narrative. In the continent of Africa, I have been opportune to serve and, in a commission by the World Bank. Our responsibility is to X-ray universal health coverage as far as the continent of Africa is concerned. What are the issues? What are the pros? What are the cons? What are the gains? I will be glad to share the report of that commission with the organizers, and then those who have signed up can have copies of that report. You can take your time and look at it and see what are the fundamental issues that govern, that drive the African continent. Now, if you are here and your bias is to go into clinical practice, there is huge opportunity in Africa. And there is also huge depressing opportunity in the continent. What do I mean by these two things? In other words, there is job. We can employ you. But then the second point is, how satisfactory is that job? Now, there are individuals who are relocating not because they are not paid, no. Not because they are not able to meet up with basic need, no. But they realize that they are not making any progression as far as their professional life is concerned. Do you know that even still up to today, one of the new things that we are championing globally is decolonization of global health? What do we mean? We mean that, in simple terms, don't recolonize us. We are not going through another round of colonization, even in the health sector. Have you sat down to ask your grandfather in the village, when his own grandfather, that is your great-grandfather, when they were sick, which hospital do they used to go? What were the things that they were doing to get better? In other words, as a people, we had a system that was working. And I'm a huge champion of that, listen, we cannot desecrate, we cannot do away with what I will call local intelligence. In other words, far, far, far before even the colonial masters come, we had something that was working for us. So why can't we look into that which has worked for us and then build on it? But going to rubbish what has been existing to say that what you are bringing is what is going to work is part of why we are where we are. So what is the scope? What does the African continent look like? We have a blowing population. Africa, as at last year, we are about 1.2, 1.3 billion people. In other words, so there is huge prospect. And out of this number of billions of people that I have mentioned, about 60 to 70% of the population are actually young people. In other words, you and I on this call today are actually the future of Africa. But then the question is Africa and its leadership of today thinking of you and me for tomorrow? The answer is no. So how can we begin to build resources? How can we begin to build network right from now as to how we can make tomorrow look better? Whether you will remain in Nigeria or you will go outside Nigeria, how can you still make the system better? Now, so we can leverage on the huge youth population. We can also leverage on the huge youth initiative. It will interest you to know that at least about 50 to 60% of your lecturers in the university, your professors in the university, they cannot do 50% of what you on this call can do with your system. And when I say your system, I mean with your laptop or with your phone. Some of your lecturers have very sophisticated phones, but the only thing they do is WhatsApp and phone call. But you are looking for such phone because what you need to do with the phone is far, far beyond that. In the earlier interaction that we had about research, before now, if you want to do research, you have to travel from one point to another. Today, you can remain in Enugu, or you can remain in Port Harcourt. You can remain in Lagos. You can remain in Ibadan. You can remain in Zaria, in Kontagora, in Katsina, in Sokoto, and still carry out a research in any region of the country, all thanks to technology. Technology. 5, 10 years ago, if somebody had told you that there can be what we are going through today on the internet, the answer will be absolutely no. It's not even going to happen. So let us also see that there is, within the health system, there are also profits that we can add to it. Now, another issue within the health system in the continent is the issue of health security. Health security. And in this context of health security, what am I talking about? In that tiny village of Nigeria, let me use Nigeria as a benchmark. In that tiny village of Nigeria, you go there and there is a woman who wants to give birth and the doctor is not around. Sometimes you meet a midwife. In fact, in some parts of this country, community health extension workers, which are referred to as CHEWs, in the communities where they come from, because they cannot distinguish between a CHEW and a nurse, and even within a nurse, they can't distinguish between a midwife and a nurse. They all refer to them as nurse. And clearly, each of these individuals has a defined role. So you also have the issue of absence of emergency medication. Absence of emergency medication. So you go to a primary health care center, that even some basic medication that you need for basic issues. Maternal and child health has been a bane in this country, okay? And so in other words, we're trying to say, like for instance, as of 2014, the maternal mortality ratio in Nigeria was hitting about 800. Today, as of today, if you get online and check with UNICEF Nigeria, Nigeria is still commanding about between 400 and 500. We are the 4th country in the world where it is not safe for a woman to give birth. The 4th in the world. The 4th. So that tells you that there are more issues. But guess what? Which has been my argument in so many forums that I go to. That village where you come from, it will interest you to know that when you go to your village, there is always a beer parlor where you can buy Heineken, you can buy Gulda to drink, Star, 5-5. But the same village does not have medication in a hospital. So the question is, what is the mechanism that is being used for alcohol to get to your village that we cannot borrow from the same mechanism to make sure that essential drugs get to the community such that we can enhance and strengthen the health system. In the UK, if you want to lose an election, go and look for trouble with the national health system, the NHS. You don't joke with that. We don't joke with that. And maybe those of you who have friends who are already, who have relocated, you keep hearing things like GP, your GP, your general practitioner. These are people that you find at the community level, which today you may wish to refer to as the local government level. But many of us are not interested to be in the local government. Why? Because it is a village, there is nothing there. It's just a building. So the health system can be strengthened by a connection of how our resources can work. Now, there are some of us on this call today who are medical students, and I have good news for you. You will finish med school and may never practice as a doctor. And you may never practice as a doctor. In other words, you may end up being a medical investor, or you can call it health entrepreneur. You went through school, you understand the rudiment, you know where the problems lie, so you have a technological driven solution as to how these things can be done. So some of us may end up becoming health security experts. In other words, you are looking at logistics as far as health is concerned. How can you transfer drugs from point A to point B such that at point A, they have sufficient, point B, they do. And the good news is that COVID has come to break the table, shake the table in every system in the world. Whether you are in the UK, whether you are in Canada, whether you are in America, whether you are in Australia, in East Africa, whether you are in Rwanda, Uganda, Zimbabwe, Kenya, Ethiopia, we are all confronted by a huge problem of the health system. So every health system, as a result of COVID, has enjoyed some amount of shake. And so communities, and in this context, when I say communities, I mean countries. Communities are going back to the drawing board as to how do we readdress this issue. And I will draw your attention to the African CDC, that is the African Center for Disease Control. It will interest you to please lay your hands on the new public health order for Africa. The new public health order for Africa. You will see the direction at which global think tank leaders, as far as health concerned in Africa is. Where are we saying should be the direction of health as far as African continent is concerned? The discussions that we are having here, we cannot just have them for conversation's sake. Don't be on this kind of conversation so that when people ask you, you can say, oh, I have actually attended an online event. It was very good. No, beyond it being very good, what is your take home? And in the take home, what are those tiny things that you want to start in your own corner? Enough is enough of having silo approach. One of the things that I work together with my colleague as I interface with the WHO, we started something that what do we call that thing? I think it was disaster medicine or something. Disaster medicine. In other words, what am I trying to say? And in my biography, you heard, between, my interest is in fragile and conflict areas. So for those of you who are still in medical school and those who have finished and those who are about to finish, you realize that the only thing that the medical school trains you in terms of emergency is that you end up working in accident and emergency, in a clinical setting. But then today, let me use Borno State, which have been confronted by Boko Haram, right? And you find yourself in that kind of a setting. That is during a conflict setting. The kind of attention you will give somebody who is in that kind of a setting is fundamentally different from what you will do if the accident individual is brought to you in a health facility. So we must begin to see each health professional as somebody who will add value that you are a doctor doesn't mean you have monopoly of the whole knowledge of what it means to take care of a patient. That is why you have a nurse. And as a nurse, you don't have the whole monopoly of knowledge as to if your patient is not taking his medication, what do you need to do? That is why you have medical social workers. So you find out that in every sphere of life, there are individuals who have been trained as to how to help the system become better. Enough is enough of us feeling alpha and omega. By the way, there is a growing trend of persons, excusing clinical practice. In other words, they are tired of going to the hospital, sitting down every day and listening to the same issues over and over. Yesterday, you wrote headache, back pain, leg pain. Oh, take paracetamol, take this. Tomorrow, you come back again, you do the same thing. So you find out that there are people who are walking away from clinical setting. They're trying to explore other aspects of how health can be dealt with. Public health, which is where I find my joy, I get a lot of excitement. You can also do research. And I remember somebody asked the question if research is not just about you going to a laboratory to work. Even in research, there is something that we call action research or actionable research. Okay, that is, it's on the spot, you do that. There is also something you call systematic review. These are also aspects of research. In other words, by systematic review, you are looking at what are the issues that have been dealt with, what are the researches that have been done, what is the outcome of such research, where is the gap? In other words, so that you don't end up going to reinvent the wheel. Many of us on this call do not even know how to sufficiently search on the internet how to get information. My friend and I'm not doing this for advert, okay? I'm just saying this to help you understand how the world is changing. My friend and I wrote a book, okay? And the title of the book is Cybersecurity for e-health. Cybersecurity. Now, in this part of the world, it may sound cybersecurity, it may sound very too early to understand, but that is the direction that the world is going to. That is the direction. In other words, if you go to developed countries in Europe and America, you don't need to go to a hospital and carry file. All your information is, is available electronically. You can call it online. But what myself and my friend try to, look at in this narrative is, okay, cybersecurity, meaning that somebody can hack into the system, change the narrative of what my document is all about. How then do we ensure that there is safety of documentation of people? Now, I have my own strength. My friend has his own strength. He is into cybersecurity. I am into health. So we look at electronic nation of health. But even at that, while we were compiling this, I had to consult friends who are already in the medical practice. In other words, I draw inspiration from a doctor. I get to hear from a nurse. I hear from a medical social worker. So within the health system, there must be a revolving system. The third component that I want to look at is health financing. Health financing. You may have heard or you may have read of something that is referred to as the Abuja Accord. Some of us are absolutely against the Abuja Accord, and I don't want to go into those issues, okay? But in a nutshell, what was that Abuja Accord all about? The Abuja Accord was a meeting of all African heads of state. They met in Abuja in 2015. No, 2015? No. When Obasanjo was still in power. I think it's 2010 or 2005, okay? And in that Abuja Accord, it was agreed that every country should make in her annual budget, 15% of her budget should go into financing. It should go, 15% of their budget should go into health. 15% of the total budget should be for health. Good news. Since when that Abuja Accord took place, even in the same Abuja, in the same Nigeria, Nigeria is a country, since that day till tomorrow, yes, tomorrow, I'm right. Literal tomorrow. That is, because the budget of this year is already settled, right? we have never hit 11% of our total budget for health. In fact, my analysis of the health in Nigeria, let me tell you one interesting thing. As of 2014, the total sum amount that was budgeted for the public health unit in the Federal Ministry of Health was 70 million naira. There are 36 states. And inside those budgets, you hear some very wild things like capacity building. Capacity building is meaning that they will go and do workshops. There are 36 states. So let's assume that that 70 million will be shared according to 36 states. That is 1 million per state. Think about a state like Lagos. What will you achieve with 1 million naira? Even if you are going to bring people who will come and do the training, and those people will come from Abuja, by the time you remove their air ticket and hotel to sleep, how much is left in the 1 million naira? It shows you the kind of attention we are giving to health. So there is need again to revisit how we fund the health system. In the board that I share, in the committee that I chair, that I'm part of in terms of the universal health, you will realize that universal health, in simple terms, we're saying health should be available for all. Health should be regardless of what your disposable income is. Health should, your lack of money should not deprive you from health. We are also saying that health should be accessible, affordable for all. In other words, you can even refer to it as health for all. Regardless of the remote village where you live, you should be able to access health. But the reality is different. Those of us, or those of you who live in Lagos, if you go by the WHO recommendation, okay, there's for every 5 kilometers or for every 5 to 10 kilometers, there should be a health facility. A health facility. If you live in Lagos, think about the neighborhood where you stay. Remove all the private hospitals that are in your in that axis between your house and the local government headquarters. How many health facilities will you find? Infrastructure, okay, which is the last point that I'm going to refer. So in other words, for us to have a functional health system, financing it, health security, re-engineering the system itself, that is looking at the economics of it. And then the fourth point that I will look at is infrastructure. And by infrastructure, I don't mean building alone. Okay? How accessible is the road to the health facility? Okay? That's question number one. What is this? How accessible is the road? How accessible, again, is it for me to move from point A to B, which is the hospital? Then, what is the physical infrastructure of that clinic or that health facility like? Is it dilapidating? Is it leaking? Is it well taken care of? In fact, there are some health facilities that if they're taking you to, you scream and say, I'm feeling fine already. Okay? Then, you're also looking at, there are some basic things that should be in a hospital. Is there availability of water? Pipe-borne water, flowing water. What of electricity? You see, so these are also infrastructural questions that can either make the health system functional or dysfunctional. And until we see it from a holistic point of view. Now look at this way. If you decide to fix the road to the hospital, you decide to renovate the hospital, and there are no drugs, there is no doctor, there is no midwife, you still have not done anything. So there is need to ensure that manpower, that is human resource, is catered for, proper funding, of the physical infrastructure of the health system. And then, of course, the very salient point is remuneration. How properly remunerated are the resources that you have within the system? Every day you hear one form of strike or the other. You hear again the state of equipment and tools, which you can also term in the infrastructure. How available are basic tools that you need? There are some health facilities that when you go, the doctors are even throwing the referral, sending you to their own private hospitals. So again, another thing you want to look at is the referral system. How is that functional? In other words, from facility A to B, when these things are not available here, I should be able to move you to the next facility. But again, even within the same system, you realize that the same problem you have in point A in facility A may likely be the same problem you will have in facility B. So I have talked so much about the problems. But then it depends on the lens upon which you are seeing all that I have said. It will also interest you to know that I have articulated the problems. The fact that I have brought out this problem, it also shows to you that this is huge potential for investment. Like I said, some of us may have to go into logistics of health, that is dealing with one aspect of health security. Some of us may have to go into clinical practice. Some of us have to go into health infrastructure, advocacy. You need to have a lending voice to keep government on her toes to ensure that these things are put in place. And then one final point that I will make is we must also learn to integrate the system. Okay? How is the Nursing and Midwifery Council adding value to the health system? How is the Medical and Dental Council adding value to the system? How is the Medical Laboratory Health Science, Council? How is she adding value to the council, to the health system? Just be above and beyond the fact that there is need for salary increase, there is need. What of the system in its own? And then, of course, finally, this is the final. We must also have workable and achievable policies to make our system functional and better. Thank you very much. I will pause here and then take questions and reactions. I hope I have been able to make some sense to you. Thank you very much and have a beautiful time as we interact with questions.
Thank you very much, sir. I must say the session has been rewarding so far. We are grateful for everything. You are so articulated and all, and we are grateful. So if you have questions, please just raise your hands. We'll take a few, and then maybe the other questions, you would have to send it and you will get your reply later. So please, if you have questions, okay. Marjani, Edward. Okay, go ahead with your question, please, Edward. Edward, can you hear me?
Yeah, of course, I hear you very well, madam. Thank you for the chance. I would like to ask a single question.
Thank you.
Okay, my question is that the health system is the target for all nations, and how weight is being placed to the health system in the case of the annual budget of which country? Is the health sectors or the health department, is it a focus, or perhaps is not a national goal to most of the country? And if it's not the target, on how we are going to mitigate those challenges, or what thing can we do so that we can address or we can mitigate those challenges? Also, my second question is concerning the resources used. I try to think, does the resources available are well utilized?
Sorry, Edward, please unmute.
Yes, madam.
Thank you. Edward, thank you very much for your question. Are you speaking from Dar es Salaam, or where are you speaking from, Edward? Can Edward be enabled so we can hear him?
Yeah, I'm speaking from Morogoro, Tanzania.
Aha, I knew you have to, Tanganyika.
Yeah, exactly.
Yeah, Tanganyika. Now, let me say this very clearly. Even in Tanzania, the problems are about one and the same. So the point we are saying, in Tanzania, you use a district level. And what I am saying is that even at the district level, you will still have situations that require government attention. Now, in the aspect of financing or health that you have made reference to, African leaders agreed that 15% of budget should be channeled towards health to make health work. But you find out that the narrative is different. Even in Tanzania today, you realize that an idea say, go and confirm what I want to say to you, that one of the biggest challenges that you are being confronted with is the fact that there is still women, who are finding it unsafe to give birth. So the question is, what is government doing to ensure that these things are put in the right place? But then again, you raised a very interesting question. Even what has been allocated, to what extent has it been able to achieve where it needs to achieve? And permit me to dovetail that question into the earlier discussion that we had. Listen, my dear friends and colleagues, research can be done to see the extent at which allocated funds were properly channeled. In Nigeria, for those of you who are here and are from Nigeria, if you don't follow this organization, I'm not making an advert for them, but create time and read what they do. Budget it, okay? Budget it, yeah, budget, BUT, budget and IT, okay? Budget it. Budget it, try to do some very critical analysis of different subheading of the government budget expenditure. Sometimes you will see that a lot of what is accrued even in the budget has nothing to do directly to the system. It goes into either travel or buying this, changing laptop, this, that. How is that going to help the system? Okay, so that's the quick reaction that I have to that. Maybe so that we can take more questions. And thank you, Edward, for your question.
Yeah, thank you too.
Okay, thank you, Edward, for the question. For want of time, please, if you have any question, you can just send to the chat box or the WhatsApp group and your reply will get to you.
Permit me to also add that it will be interesting that if you are here and you want to learn through the ranks, reach out to organizations of this nature that have put this event together. And I think one of the take home that we can do is to begin to network with one another and see how we can also serve as guide. I don't want to use the word mentors. If you want to use the word mentor, that's fine. But those who have had the opportunity to go ahead, how do you help those who are coming from behind? One of the biggest problem with Africa is if in front, you only want you to always be in the front. And that cannot take us anywhere. It takes us nowhere. Okay? And until we learn to network and help one another, then we can begin to grow. If you are interested, you want to learn how to start writing research papers, you know, what you got, one of the things you can do, if you find somebody who is writing, let the person give you an opportunity to write something, write back, you take it back, you make it. So one of the biggest challenge about that is the ability to
Sir, we can't hear you, sir.
enough to go through the hassle of wanting to learn. Thank you.
Thank you very much, Dr. Jonathan Dangana. Thank you very much for the session, and thank you for answering the question. So if we have more questions, we'll forward to you. Thank you, sir. Thank you, the participants. We're sorry for the inconveniences. We know that some of you had...
host, I'm not sure.
Sorry, sir. What did you say, sir?
Oh no, it's because we didn't hear from you. So I was saying, you know, I was trying to call your attention to know if you are there.
Okay, sir, can you hear me now?
Yes, very clearly.
Okay, yes, I was thanking you for the session. It was really rewarding and impactful. Thank you very much.
Thank you.
We will get questions from participants if they have, and we'll forward to you, sir.
Oh, excellent. I will be more than available to be of help. I'm not making a commercial, if you permit me. You can check me out on Instagram or Twitter, and then feel free to always, you know, at any point you are doing anything that you think I can be of help, just drop me a message. And then we can always try to see how we can be of help to one another. Because if Africa must be great, one person is not sufficient to make it great. But all of us, a concerted effort will be a great one to help one another. And I'm sure that is why events of this nature are put together for all of us to be able to integrate and learn from one another. Thank you.
Thank you, sir. And sir, can you also tell us how we can get your book?
Okay, so I will communicate that through the coordinator, and then even if it means making a complimentary copy available to the organization, I think I can be able to do that.
Okay, sir. Thank you very much.
Thank you.
So I'll call Dr. Ada to continue the session.
Thank you.
Okay, thank you to them so far. Thank you so much, Dr. Jonathan. It was a very, very, very enlightening session. There's a lot to learn, you know, a lot to appreciate, and it was very motivating as well. Okay, so please, let's just kindly take the following announcements. First of all, on behalf of the entire organization in YOHAN, we want to sincerely apologize for what happened earlier on in the beginning of today's session. It wasn't planned for at all. It was just a mishap that happened. We promised to do better. Please stop sending the emails to the WhatsApp group. Let's stop sending the emails to the WhatsApp group. Today's session was recorded and is going to be sent to everyone at the end of this summit, okay? So your emails, stop sending them for now, okay? We'll collate them tomorrow. Then midway, we were able to, you know, share the link on another platform, I think WebEx or something. So I don't know, just in case anyone missed out, I dropped the link in the chat box and it was also available on WhatsApp. So we're truly sorry for what happened earlier today. Tomorrow, the summit continues. Tomorrow promises to be even more packed than today. We're expecting a lot of people tomorrow. Okay, we're expecting 2 more people tomorrow. And it's super, their topics are super, super, super interesting. So if you felt like you enjoyed today, then please look forward to tomorrow. Do us a favor by sharing the flyers on LinkedIn. You can follow YOHAN on LinkedIn, on Instagram, on Facebook, on Twitter for more updates. Please share the flyers and help us to repost for more publicity. By God's grace, tomorrow we are making arrangements to accommodate as many people that want to join. What happened today won't happen again tomorrow. Then please take note that for the certificates that we issued out, they are not going to be issued out to everyone that registered. They are only going to be issued out to those who were able to fill the satisfactory Google forms tomorrow, which will be released tomorrow. Okay, so I also want to appreciate everyone. Everyone was coordinated. People's mics were muted and all that. Also want to apologize to those who are not able to take their questions. Kindly send your questions to us, either to me or to Dubem or to Dr. Ogamba. Our numbers are available on the WhatsApp link. And yes, thank you very much. Without further ado, I think we'll come to a close. All right, so see you tomorrow. Have a lovely evening. Goodbye. Bye.
Goodbye.